Good afternoon สวัสดีค่ะสวัสดีค่ะ Welcome back to Health Dialogue by BDMS. Today we are here with the Director of Bangkok Phuket Colorectal Disease Institute and Director of Colorectal Surgery Clinic, Bangkok Hospital Headquarters. He's also the President of American College of Surgeons, Thailand Chapter, Governor of International College of Surgeons, Chicago, USA. We are here with Professor Dr. At Hiranyagat. Welcome, Doctor. สวัสดีค่ะ We are glad to have you here again, back to our program.
Right.
Yes.
Me too, because I know that this program has been very famous lately.
Yes, and we are here today not only for the expat on Phuket Island, also for the expat in Krabi.
Right.
Yes.
Welcome everybody from Krabi as well as Phuket fan club.
So I hope that everyone still remember our Dr. Art. Today we cover our faces. Yes.
Right.
Okay. So it sounds like the topic for today. It sounds easy and simple, or someone feel even like it's not important at all. But why you give us the topic? Why stool test is important?
Yeah.
I think you have a lot of reason to tell us today.
Right. That's why I think the majority of the patients who would come for the checkup in our hospital or other hospital elsewhere would be skipping stool test, excusing that okay, sometimes you don't feel like you want to go to the toilet on that day or so. So now today hopefully we would be able to change your mind of trying to provide some important information regarding to the stool test.
Yes, since we have our health fair or the promotion here in our hospital, and we are checking are some simple tests are not include the stool test, but I've been discussed with Dr. Art before, and we find out that I myself also feel like, oh, it's so important. Why stool test is important? I think we all would like to share this information with you.
Right. Yes. So to be
kind of people like to skip it.
Right.
Or it's maybe it's not included in the package.
Yeah.
I don't want to add it.
Right.
Yeah, actually it's just like few hundred.
Right.
But I heard from you that it can save life.
Of course, yes, certainly. Yeah. So should we start?
Yes.
So we would start with the overview of what colon is and where it is located. So this slide would show where the colon is located. It's actually the last portion of the guts that would be functioning as to collect and empty the waste from our body. But the most important, we always all the time we would like to scare people a little bit before going into other details. So believe it or not, the colon cancer is the second most common cancer found in both genders in Thailand, and the third most common cancer found from all around the globe. But the most important thing is that if we look at the statistic from WHO, the World Health Organization, reported that colon cancer is responsible for the second largest cancer death worldwide.
Oh.
So
people normally focus only on the breast and also the liver.
Breast is the first, the most common, and here in Thailand, colon is the second, and the liver is the third.
Okay.
Right. So as we know that as other cancers, I think colon cancers would be similar in staging and severity of the diseases. Ranges from stage 1, which is the early stage, to stage 4, which is a quite advanced stage. So if we can choose, everybody would choose not to be one of the cancer patient.
No.
Or if it would have to be one of the cancer patient, we would want to be in the first and very early stages. Right. The most important information and regarding to colon cancer, which is not the same as the other organ cancer, believe it or not, once again, that colon cancer is not really started with cancer to begin with, but it started from something benign. And the benign something that would grow to cancer if we leave them for long enough is called the polyps. And these slides is showing the photos of the diagram of the polyp that we talked about. And if the polyp is staying in your large intestine for long enough means 5 to 10 years, then it would grow bigger and bigger, and the cell would be changes from benign cells to cancer cells.
Oh.
So you're right. If we can tickle or if we can attack the polyp beforehand, that would be the key of colon cancer prevention.
So if we continue our daily basis living, will we feel the polyp?
Yeah.
That we have one in our colon?
That's a very good question, because as you could see from the slide that the polyp is very tiny, and the bowel, the lumen of the bowel, the large intestine is quite big as compared to the polyp relatively. And most of the majority of the patients with the polyps, they would not have any symptoms. And those symptoms that would be related to colon cancer would be including abdominal pain, rectal bleeding, the bleeding that you could see from your bare eyes, constipation, change in bowel habits, anemia, and sense of incomplete evacuation, for instance. And polyps would not provide those kind of symptoms. So now the question is, how do we pick up the polyps? So in general, all the cancer society worldwide would be recommending anybody, gentleman or lady who at the age of 45 or above without symptoms, once again, without symptoms, to come for colon cancer screening.
Oh, okay.
And we have been showing this slide for quite some time. Colonoscopy would be the gold standard for colon cancer screening.
But if we talk about colonoscopy, people has variety reason. I'm not ready for that yet.
Right.
Kind of.
Yeah. The majority of the patients or people, the population at the age of 45 or above would have all the excuses not to come for colonoscopy. Maybe they would say, oh, it sounds invasive, it sounds dangerous, or it's very complicated. You have to clean your bowel before the procedure. And some would say, oh, this procedure is quite expensive. So do we have other alternatives as to screen for colon cancer and skip the colonoscopy?
Yes. So let's start with something simple and easy.
Right.
Yeah. Maybe I have another choice, because sometimes not the reasons about the money or even the difficulty, but I feel shy, kind of.
Right. And sometimes you have to come out of work for colonoscopy, and you may think that why do we have to do that? Because we have no symptoms, and we don't want to waste time to come and book for colonoscopy. Now the stool test would come in the role, in play, that colonoscopy could be skipped, but stool test is one of the alternatives that would be used as to screen colon cancer.
Okay.
How? Because as you could see that some of the polyp that would stay in your large intestine or even the early cancer, there would be the combination of the new cells and the new blood vessels. And those new blood vessels, as they were in they are in the large intestine, when the poop come around, it would traumatize those little small blood vessels, and it would cause a very, very minute bleeding. Tiny bleeding, tiny bit of bleeding.
That we cannot find if we check by ourselves. We
No.
cannot see it.
Exactly, because like any bleeding that would be less than 3 cc's or milliliter per day would be mixed well with the poop, and you would not be able to tell if you have that small amount of bleeding.
Oh, that means if you see more amount of bleeding, I mean, that is kind of not first step.
No, because
wow.
like it's easy if you have if you could see the bleeding in your stool, you would run to the hospital to see the doctor right away. But this is the thing that we may not be aware of, and we don't even know it's bleeding inside your large intestine because of the polyps or early colon cancer.
So the the stool test should be done at which age? Because we talk about colonoscopy for 48 or cancer screening 45 years old.
Yes.
But how about the stool test?
Same indication at the age of 45 and above, either you're a lady or gentleman, you would be recommended to come to the hospital for colon cancer screening. And one of the options, and very easy option, and it's considered as a home-based test, is the stool test. And the importance of the stool test is to look for the red blood cells or the hemoglobin within the normal looking stool.
I saw sometimes someone who come into the hospital and even book a big package of checkup and took the container back home because they cannot do it on that day.
Right.
But they never returned with that container.
This is very important, and if you know it is important, and if you know that you would get a small little container, you would be more than welcome to give us back the container whenever you're ready with a little of your poops in it, so that we can test and that we can screen for colon cancer for you.
Yes. This is what I heard also from the nurse at the station, at the wellness center. We are ready and welcome your small container with the poop, please bring it back and have the test done.
Yeah.
We care about your health.
Right. But some of the people and some of the patients would have a wrong idea of the blood test for colon cancer screening. That's why they would ignore the stool test.
They think maybe the blood test is more information to continue or discuss about the treatment. Right.
Maybe they thought that they've done the blood test as so-called on the advertisement, that it would be a tumor marker for colon cancer, especially the CEA, carcinoembryonic antigen in the full terminology. CEA, I would tell you now that the CEA is not a standard test as to screen for colon cancer. Because if we do the CEA on 100 patient diagnosed colon cancer, only 75 of them, approximately 75 of 100 colon cancer patient would have the elevation of the CEA or the abnormal CEA, but around 25 patients with colon cancer, they would be ended up with normal level of the CEA.
So it's not the 25%, it's not detected by CEA.
Exactly. So that's that's very important and that's very risky because sometimes patients with early symptoms, sometimes they have bleeding or they're not sure that they have something wrong in their large intestine, then they would come to the hospital for CEA, believing that CEA would be the best answer to diagnose colon cancer. And if it becomes normal, they would think that they're not having colon cancer, and that's not correct. That's wrong.
So is it better if I do the CEA? I still want to do it, but plus the stool test.
Right. The stool test is more reliable. The CEAs is not recommended by as to screen for colon cancer by any of the standard organization for colon cancer treatments.
So after we've done the stool test and we detect something or some percentage that you may explain later, and then after that, what should we do after the stool test done? When we get the result, when we talk to and discuss with the doctor,
Right.
what coming up next after that?
The stool test has a very good accuracy as to detect the polyp and at the same time early colon cancer, and the efficacy of the stool test, especially for fecal immunochemical testing or FIT that we use all the time in our hospital. These accuracy would be up to 75 to 80%, which is quite high.
Okay.
Right. So that's, I think stool tests seem to be very simple, very cheap. Most of the patient would be ignoring doing it, but it's very important and cost effective as to screen for polyp or colon cancer.
Oh, now I feel it's like very easy for the patient or customer.
Right.
If I'm the customer, I just bring the sample for the nurse, and after that, you do your job.
Right.
And when I get the result, I come back and talk to the doctor.
Exactly. Very convenient, right?
Very convenient.
Right. So yeah. So the stool test, if it's negative, you can be you can have peace of mind that
okay.
Perhaps you have done the right and the standard test for colon cancer screening and you're negative, you can skip colonoscopy.
And I can live peacefully for a year.
Exactly.
And next year I have to do it again.
Right.
Okay.
Stool test should be repeated yearly. So we do the stool test every year.
Negative, live peacefully for a year.
Right.
But if positive?
If positive, then you will be invited for seeing us, seeing me, and then I would be strongly recommending the positivity of the stool test population to come to our endoscopic suite for colonoscopy.
Yeah, I think if we can check, like very easy. You told me just kind of stool test and we can live peacefully. And is that special focus on those who has like family member or who has the family history about cancer?
Right.
Should we come earlier?
Right.
Should we wait until 45 or should we come earlier and do something special compared to other people who has no history in the family?
Right. That's important as well. Anybody who's got the first degree relatives diagnosed colon cancer or rectal cancer, those population should come as quick as possible to the specialist for the advice of what to do, because there would be a lot of detail in that specific group of people.
Yes. Can you explain a little bit more about colonoscopy? I think maybe people just know from friends or from the neighbor, maybe by some experience, maybe it's not so nice. I mean, why and how when people do the colonoscopy with you, and I don't know what to say, like the result and the treatment plan, if you find, for example, the polyp or something else.
Right. So actually, colonoscopy has been around as a gold standard for colon cancer screening and at the same time for colon cancer diagnosis. For some reasons, the good reasons for that is colonoscopy can provide a very clear image on what's going on in your large intestine to see clearly if there's any polyp or tumor. If we see polyps, colonoscopy at the same time can remove the polyps. Remember, the polyps is a benign condition, but if we leave it for long enough, it would grow bigger, and the cells would turn to cancer cells. So it's very important and crucial to remove completely all the polyps that the colonoscopy would be picking up. And this diagram would be showing how one of the way that the colonoscopy and the small little equipment and instruments would be advanced as to remove the polyps.
From this slide, compared to the first slide, the polyp doesn't look the same.
No, because polyps got at least like 5 big categories, and they're not looking the same, and the cell type are not the same as well, and some of them carry the risk for cancer development differently from the other.
Okay.
And now the technology for colonoscopy has been developed with a lot of advanced technology. Even the AI was combined during the colonoscopy as to help the endoscopist to detect the polyp or abnormality during the colonoscopy or the procedure. And to prepare for the colonoscopy is not as complicated as what the majority of the people knows about. It's very convenient. We can only modify the diet a day prior to the procedure, and laxative would be prescribed to take only the evening before the procedure. You don't need a week to prepare to clean your bowel, and you don't need to fast for 4 or 5 days as in the past to clean your bowel. Now you can do what I mentioned, and then you can stop your eat and drink after midnight, just the day before the procedure.
Or just like prepare myself for the annual checkup.
Yeah.
Doesn't sound different.
No, not at all. And then the colonoscopy would be scheduled first thing in the morning with deep sedation safely by the anesthesiologist, and you would not feel anything. And the procedure itself would take about 10 to 15 minutes as to complete the examination of the whole large intestine. But if we happen to find some polyps or something that we need to add on some procedures, the timing would be added as the additional procedures as well. So roughly, it would take around 10-20 minutes for normal colonoscopy, and you would be waking up right after the procedures, and you would be monitored for another 2 hours just to make sure that you're fully awake from all the sedatives. And then you would be reported by the endoscopist of what the doctor found from the colonoscopy. And then after that, you would be free to go.
So I don't have to be admitted. I just have to be like at least a couple hours,
right?
And this will be done.
Right. Very convenient indeed nowadays. And if the most important thing is that people may not know that if you come for colonoscopy, which is the gold standard as to screen for colon cancer, and if the colonoscopy turn out to be a negative colonoscopy, if you don't see any polyps, you don't see any tumor, the next colonoscopy should be scheduled at 10 years.
Okay.
Yeah, 10 years.
If you find nothing, so don't be sad. It's also good news.
Is it worth it? Like once every 10 years?
Every 10 years.
Right.
Oh.
Right. Because it's the technology nowadays is very advanced, and we can see clearly by the camera of colonoscopy. And if we do see anything that we're not sure about, we can always get the tissues to send for the lab and studied. And then if we see and we picked up any polyp which can be become cancer in a long run, then we can remove all of them. That's why colonoscopy is the gold standard.
Which also can be like this in this slide that there are so many polyp.
Yeah,
or
sometimes we find many polyps like that as well. But remember, if you find many polyps and we can remove all the polyps, then your risk for cancer development
is removed. Okay. So then we will see doctor again after 10 years.
Yes.
But what about, for example, after 3 years, 4 years, if I keep doing the stool test every year and it's positive, then will turn me to the colonoscopy before 10 years or not?
Yeah, actually, we would be recommending for the patients to go for either the standard colonoscopy, or if you're not convenient with the colonoscopy, you can choose a very simple home-based test, which is the stool test. But for the stool test, we should be doing it every year, because like sometimes some polyps, small polyps, would not bleed every day, or sometimes that sample of the stool would not be containing blood. So that's why we know the limitation of the stool test, but we know that it's effective as well. But we would need the patients to repeat doing the stool test every year. But after the colonoscopy, if it's negative, you don't need to go for stool test for 10 years.
Oh, okay. May I ask you, between the stool test and colonoscopy, do you have anything in the middle? Kind of, if, for example, someone still cannot afford the colonoscopy, can you give me another chance? Have you got any other tests that maybe can help me for a year to stay at peace, and next year I will come back for the colonoscopy, for example?
Right, I understand. Like, and we are kind enough to offer the other alternatives as well. Not the stool test, but more accurate than the stool test, but not as invasive or even accurate as the colonoscopy. The middle, in the middle, I would say we can go for, we call it virtual colonoscopy. Virtual colonoscopy could be done using the CAT scan machine, just like you go for the CAT scans, really. Very convenient, very fast, and not invasive.
Okay. So if we do the colonoscopy, and you said someone never come, but once when they make decision to come with symptom, and it's go already to the 3rd state or 4th state, just let me have an idea what's coming up next after that. Can we help and treat them in our hospital, or where they have to go to get the treatment done?
Right. For colon cancer patients, I would say we in Bangkok Hospital or Bangkok Phuket Colorectal Disease Institution, we are providing a comprehensive one-stop service, world-class services on cancer treatments. So we can offer all kind of standard treatments that you could find in other world-class center overseas as well. So we can take care of the early cancer, and we can provide surgery, minimal invasive surgery if needed. You don't need to stay in the hospital for that long. Pain is less, fast recovery. And if the patient would need additional treatments, we can provide those treatments in one-stop comprehensive centers as well. And we have patients flying in from all around the world to get colon and rectal cancer treatments in our institutions also.
Okay, but Ladies and gentlemen, all the audience, the first thing we have to do is focus on your health. You don't have to invest much. Don't start with thinking about colonoscopy, but start with something simple but very important. It's stool test.
Right. Yeah. Yes, stool test is considered a very cheap alternative and very effective. So it's very cost effective as to use as a screening tool for colon cancer or even screening of polyps, colonic polyp screening. So next time, if you come to any hospital and for the checkup, and the nurses would be providing you a small bucket container for the stool. Don't forget to use it. If you're not convenient to use it on that day, you can bring it home and put your poops in and return the container with your poop to the hospital at your convenience.
Yes, you have to do that. I said so, nah? Because it's so important now. We know that if you book or you do the checkup, I mean, even in the other hospital, I have to say, please request that you need the stool test to be done as well. And whatever happened, if you want to consult Dr. Art, we are here at Bangkok Hospital, Phuket, and you can contact us at 1719, or you can reach our Facebook, our website. And thank you very much for today.
Thank you.
Okay, thank you. So if you need any information, please contact us. And right now at Bangkok Hospital Phuket, we have like a health fair, yeah, special rate, special price, and please invest in your health. Thank you and goodbye for today. Thank you, Dr. Art.
Thank you for having me.
Thank you, everyone.